Hashtag feel this in your head at night. It's a critical warning sign of an impending stroke. The silence of night can be deceptive, masking warning signs that could save your life. When unusual sensations strike your head during evening hours, your body may be desperately trying to communicate a critical message about your cardiovascular health, one that demands immediate attention and swift action. Medical professionals across the United States witness countless preventable tragedies each year, cases where early warning signs were dismissed as minor inconveniences or temporary discomforts. The reality remains that stroke prevention begins with recognition, and recognition begins with understanding the subtle yet significant symptoms that often emerge when we least expect them. Hashtag understanding the critical connection between nighttime symptoms and stroke risk. Research conducted by leading neurological institutions demonstrates a profound correlation between evening onset symptoms and subsequent cerebrovascular events. The human body operates on intricate circadian rhythms that influence blood pressure, heart rate, and neural activity, creating specific windows of vulnerability that savvy individuals learn to recognize and respect. The phenomenon known as nocturnal hypertension affects millions of Americans without their knowledge, creating conditions where blood vessels experience unprecedented stress during what should be restorative sleep periods. This silent elevation of blood pressure, combined with changes in blood viscosity and coagulation factors, establishes the perfect storm for cerebrovascular compromise. Neurologists specializing in stroke prevention emphasize that evening symptoms deserve heightened attention because they often represent the body's early warning system activating during periods of physiological transition, as your cardiovascular system adjusts to nighttime parameters. Any disruption in this delicate process can manifest as head-related sensations that serve as crucial indicators of impending danger. Hashtag recognizing the specific head sensations that demand immediate attention. The sensation most commonly reported by pre-stroke patients involves a peculiar pressure or fullness in the head that intensifies during evening hours, often described as feeling like your head is being squeezed from the inside while simultaneously experiencing a strange weightiness that defies explanation. This uncomfortable combination frequently accompanies changes in vision, hearing, or cognitive clarity that patients initially attribute to fatigue or stress. Throbbing sensations that differ markedly from typical headaches represent another critical warning sign, particularly when they occur with rhythmic intensity that seems to match your heartbeat. These pulsatile symptoms often indicate increased intracranial pressure or compromised blood flow, conditions that require immediate medical evaluation and intervention. Many individuals report experiencing unusual tingling or numbness in specific areas of the head or face during evening hours, sensations that may start subtly but progressively intensify over minutes or hours. These neurological symptoms frequently herald the onset of transient ischemic attacks or minor strokes that serve as harbingers of more significant cerebrovascular events. The sensation of electrical-like jolts or shocking feelings in the head, particularly those that seem to radiate from one area to another, represents a serious neurological warning that should never be ignored. These symptoms often indicate disrupted neural pathways or compromised blood supply to critical brain regions. Hashtag the science behind evening onset cerebrovascular symptoms. Circadian biology reveals fascinating insights into why stroke-related symptoms often emerge during evening hours, with research demonstrating that blood pressure naturally fluctuates throughout the day in patterns that can either protect or predispose individuals to cardiovascular events. Understanding these patterns empowers you to recognize when normal variations become dangerous deviations. The evening hours bring significant changes in hormonal profiles, particularly the release of cortisol and melatonin, substances that directly influence cardiovascular function and blood vessel reactivity. When these hormonal shifts occur in individuals with compromised vascular health, the resulting physiological stress can trigger symptoms that serve as early warnings of impending stroke. Blood viscosity changes throughout the day affect how easily blood flows through increasingly narrow or damaged vessels. Evening increases in blood thickness, combined with potential dehydration from daily activities, create conditions where marginal blood flow to brain tissue becomes critically compromised, manifesting as the head sensations that prompt concerned individuals to seek medical attention. Autonomic nervous system transitions between day and night functioning involve complex adjustments in heart rate, blood pressure, and vessel tone. When these transitions occur in individuals with existing cardiovascular risk factors, the resulting physiological stress can unmask underlying problems that remain hidden during less demanding periods. Hashtag identifying personal risk factors that amplify evening symptom significance. Age represents the most significant non-modifiable risk factor for stroke, with individuals over 50 experiencing exponentially increased risk that makes any unusual head sensation worthy of serious consideration. The aging process affects blood vessel elasticity, heart function, and blood pressure regulation in ways that create vulnerability to cerebrovascular events. Hypertension affects approximately 45% of American adults, creating a massive population at elevated risk for stroke-related complications. Individuals with known high blood pressure must treat any unusual evening head sensations as potential medical emergencies requiring immediate professional evaluation. Diabetes mellitus fundamentally alters blood vessel health throughout the body, creating conditions where even minor circulatory disruptions can have catastrophic consequences. Diabetic individuals experiencing evening head symptoms face significantly elevated risk for cerebrovascular events and require aggressive medical intervention. Atrial fibrillation and other cardiac arrhythmias create turbulent blood flow patterns that predispose individuals to clot formation and subsequent stroke. Anyone with known heart rhythm abnormalities must consider evening head sensations as potential indicators of embolic events requiring emergency care. Sleep apnea affects millions of Americans and creates repeated episodes of oxygen deprivation that damage blood vessels over time. Individuals with sleep disorders who experience unusual evening head sensations may be experiencing the cumulative effects of chronic oxygen debt on brain tissue. Hashtag the critical importance of immediate medical response. Time represents the most crucial factor in stroke treatment, with medical professionals emphasizing that every minute of delay can result in the permanent loss of millions of brain cells. Recognizing this reality transforms unusual evening head sensations from minor inconveniences into potential medical emergencies demanding swift action. Emergency medical systems across the United States have developed sophisticated protocols for rapid stroke evaluation and treatment, but these systems can only be effective when individuals recognize symptoms and seek help promptly. Hesitation or denial can transform a treatable condition into a devastating disability. Modern stroke treatment includes revolutionary interventions such as tissue plasminogen activator and mechanical thrombectomy, procedures that can literally reverse stroke damage when administered within critical time windows. However, these life-saving treatments become increasingly ineffective as time passes, making early recognition and response absolutely essential. The concept of the therapeutic window emphasizes that stroke treatment effectiveness decreases rapidly with time, creating a situation where minutes can determine the difference between full recovery and permanent disability. This reality makes unusual evening head sensations potential harbingers of time-sensitive medical emergencies. Hashtag advanced diagnostic approaches for evening head symptoms. Computed tomography scans provide rapid evaluation of brain tissue and can quickly identify hemorrhagic strokes or other structural abnormalities that might cause unusual head sensations. Emergency departments utilize CT technology to make critical treatment decisions within minutes of patient arrival. Magnetic resonance imaging offers superior detail for identifying ischemic strokes and other subtle brain abnormalities that might not appear on CT scans. While MRI takes longer to perform, it provides crucial information for treatment planning and prognosis determination. Carotid ultrasound examinations can identify significant narrowing or blockage in the major arteries supplying blood to the brain. These non-invasive tests help physicians understand whether unusual head sensations might be related to compromised blood flow through these critical vessels. Electrocardiogram testing can identify heart rhythm abnormalities that predispose individuals to stroke. Since cardiac arrhythmias often cause embolic strokes, ECG evaluation represents a crucial component of comprehensive stroke risk assessment. Blood pressure monitoring, particularly ambulatory monitoring that tracks pressures throughout the day and night, can identify patterns of hypertension that might explain unusual evening head sensations. This information proves invaluable for both immediate treatment decisions and long-term stroke prevention strategies. Hashtag lifestyle modifications that reduce evening symptom risk. Dietary approaches proven to reduce stroke risk include the Mediterranean diet pattern, which emphasizes fruits, vegetables, whole grains, lean proteins, and healthy fats while limiting processed foods and excessive sodium. Research demonstrates that individuals following Mediterranean dietary principles experience significantly reduced rates of cerebrovascular events. Regular physical activity improves cardiovascular health through multiple mechanisms, including blood pressure reduction, improved cholesterol profiles, enhanced blood flow, and better blood sugar control. Even moderate exercise such as brisk walking for 30 minutes daily can substantially reduce stroke risk. Stress management techniques including meditation, deep breathing exercises, and progressive muscle relaxation can help control blood pressure and reduce the physiological burden that contributes to stroke risk. Chronic stress creates inflammatory conditions that damage blood vessels over time. Sleep hygiene practices that ensure adequate rest and proper sleep positioning can reduce the risk of nocturnal hypertension and other factors that contribute to evening symptom development. Maintaining consistent sleep schedules and creating optimal sleep environments supports cardiovascular health. Smoking cessation represents one of the most powerful interventions for stroke prevention, with former smokers experiencing rapid reductions in cerebrovascular risk after quitting. Tobacco use damages blood vessels, increases clot formation risk, and elevates blood pressure through multiple mechanisms. #The role of medication management in symptom prevention. Antihypertensive medications require careful titration and monitoring to achieve optimal blood pressure control throughout the day. Evening dosing of certain blood pressure medications can help control nocturnal hypertension that contributes to unusual head sensations. Anticoagulant therapy for individuals with atrial fibrillation or other clotting disorders requires precise dosing and regular monitoring to balance stroke prevention benefits against bleeding risks. Proper anticoagulation can prevent embolic strokes that often present with sudden onset head symptoms. Statin medications for cholesterol management provide benefits beyond lipid control, including anti-inflammatory effects that stabilize arterial plaque and reduce stroke risk. These medications work best when combined with dietary modifications and regular exercise. Diabetes medications must be carefully managed to prevent both hyperglycemic and hypoglycemic episodes that can contribute to cerebrovascular symptoms. Optimal blood sugar control reduces long-term stroke risk while preventing acute symptoms related to glucose fluctuations. Aspirin therapy for appropriate candidates can reduce stroke risk through antiplatelet effects, but requires careful consideration of bleeding risks and individual patient factors. Low-dose aspirin represents a powerful preventive tool when used appropriately. Understanding the psychological impact of evening symptoms. Anxiety about unusual head sensations can create a cycle of worry that actually worsens symptoms through stress-induced physiological changes. Learning to distinguish between anxiety-related symptoms and genuine medical emergencies requires education and sometimes professional counseling support. Depression commonly accompanies chronic medical conditions and can negatively impact stroke recovery and prevention efforts. Addressing mental health concerns represents a crucial component of comprehensive cerebrovascular care. Family dynamics often change when one member experiences concerning symptoms, creating stress that can worsen underlying medical conditions. Involving family members in education and treatment planning improves outcomes for everyone involved. Sleep disturbances related to worry about symptoms can create fatigue that worsens daytime function and potentially increases stroke risk. Addressing sleep concerns through both medical and behavioral interventions improves overall health outcomes. The economics of early intervention versus delayed treatment. Stroke treatment costs in the United States exceed billions of dollars annually, with individual cases often requiring hundreds of thousands of dollars in acute care, rehabilitation, and long-term support services. These staggering costs pale in comparison to the human suffering and lost productivity associated with stroke disability. Early intervention for unusual evening head symptoms, while requiring immediate medical resources, costs substantially less than treating a completed stroke with all its associated complications. This economic reality supports aggressive evaluation of concerning symptoms. Disability costs associated with stroke include not only direct medical expenses but also lost wages, caregiver burden, and reduced quality of life that affects entire families. Preventing stroke through early recognition and treatment represents tremendous economic and social value. Insurance coverage for stroke prevention services continues to evolve, with many plans now covering comprehensive risk assessment and management programs. Understanding your insurance benefits can help you access appropriate preventive care without financial hardship. #Emerging technologies in stroke prediction and prevention. Artificial intelligence applications in stroke prediction utilize complex algorithms to analyze multiple risk factors and identify individuals at highest risk for future events. These technologies may soon provide personalized risk assessments that guide prevention strategies. Wearable devices that monitor heart rhythm, blood pressure, and other physiological parameters offer the potential for real-time stroke risk assessment. These technologies could alert individuals to concerning changes before symptoms become severe. Telemedicine platforms now enable remote consultation with stroke specialists, making expert evaluation more accessible to individuals in rural or underserved areas. These services can provide rapid assessment of concerning symptoms without the delays associated with traditional healthcare access. Mobile applications designed for stroke education and symptom tracking help individuals monitor their risk factors and recognize warning signs. These tools complement but do not replace professional medical evaluation and treatment. Building a personal stroke prevention strategy. Risk assessment begins with honest evaluation of your personal and family medical history, including documentation of blood pressure patterns, cholesterol levels, blood sugar control, and other modifiable risk factors. This baseline information guides prevention efforts and helps healthcare providers make informed treatment decisions. Regular medical monitoring through scheduled healthcare visits allows for early detection and treatment of conditions that increase stroke risk. These appointments provide opportunities for medication adjustments, lifestyle counseling, and screening for new risk factors. Emergency action planning involves creating a written plan that details what to do if concerning symptoms develop, including contact information for emergency services and healthcare providers. Sharing this plan with family members ensures rapid response when time is critical. Support system development includes identifying healthcare providers, family members, and community resources that can assist with prevention efforts and emergency response. Having a strong support network improves both prevention success and recovery outcomes. The future of stroke prevention and treatment. Research into neuroprotective agents continues to yield promising compounds that might prevent brain damage during stroke onset. These medications could extend treatment windows and improve outcomes for stroke patients. Stem cell therapy research offers hope for brain tissue regeneration after stroke, potentially reversing disabilities that were previously considered permanent. While still experimental, these approaches represent exciting possibilities for future treatment. Genetic testing for stroke risk factors may soon provide personalized prevention recommendations based on individual genetic profiles. This precision medicine approach could revolutionize stroke prevention strategies. Prevention program development focuses on community-based interventions that address stroke risk factors at the population level. These programs recognize that individual prevention efforts work best within supportive community environments. Conclusion. Transforming knowledge into life-saving action. The unusual head sensations that concern you during evening hours represent your body's sophisticated warning system attempting to protect you from potentially devastating cerebrovascular events. Ignoring these signals or dismissing them as minor inconveniences could result in missing critical opportunities for prevention and treatment. Medical science has provided us with unprecedented tools for stroke prevention and treatment, but these advances can only benefit individuals who recognize symptoms and seek appropriate care. Your willingness to take evening head sensations seriously could literally save your life or prevent permanent disability. The investment in immediate medical evaluation for concerning symptoms, while sometimes resulting in reassuring normal findings, represents sound medical and financial decision-making when weighed against the catastrophic costs of untreated stroke. Emergency evaluation provides peace of mind and potentially life-saving intervention. Your commitment to understanding stroke risk factors, recognizing warning signs, and maintaining optimal health through lifestyle modifications and medical management creates the foundation for successful stroke prevention. These efforts require ongoing attention but provide tremendous returns in terms of health, function, and quality of life. The evening hours need not be a time of worry and concern when you are equipped with knowledge, prepared with action plans, and supported by competent medical care. Unusual head sensations can be addressed promptly and appropriately, transforming potential medical emergencies into opportunities for prevention and improved health. Remember that stroke represents a medical emergency requiring immediate professional evaluation and treatment. unusual evening head sensations in individuals with risk factors deserve serious consideration and prompt medical attention that could prevent devastating consequences and preserve your health, function, and independence for years to come.